Hello, everyone, and welcome back to the Yonya Health Tech podcast. We have our guest, Nancy, here. Nancy, could you tell our listeners a little bit about you and what it is that you're up to in the world? And I guess we could start there with anything else you want to say before we really kind of kick off the podcast.
Happy to, happy to. Thanks for inviting me to be on your podcast. My mission is to have more women world leaders. Remember the family photo in Egypt with all those heads of countries, states? I think there was one woman, and that's the president of Italy. So that's my underlying mission. But my business is Women, Worth, and Wellness. It's 31 years old, and my focus is on women's health and wealth, net worth and self-worth, philanthropy, and legacy planning. So very, very holistic in terms of all of the areas that we seek to address. I was a wealth advisor when I created this trademark brand and realized that, you know what? If we don't have our health, it doesn't matter how much money we've got. Because often if people haven't looked after their health, then they need to spend their wealth to circle back to look after their health. So my number one priority is, as I encourage people to get a total life plan in place, is to make your health the number one priority. If you're healthy today, that is absolutely perfect. But the key question is, what do I need to do in order to stay healthy? And knowing that you're healthy, knowing that you're making yourself the number one asset, means that you're able to help other people be the best that they can be, which is often what women have as their number one priority. Everybody else's well-being versus their own.
Wow. Yeah. I can really, at least from the women who've been in my life, I can kind of definitely see where that has kind of come up and whatnot. So I want to really acknowledge that what it is you're up to is really right there, not only just in the world, but I can only imagine too that, and I guess as I was saying this too on a previous guest, is there like a moment or something that you'd like to share, I guess, with listeners here too, that kind of really stuck out? I know there's probably a number of them to think, but I guess one that, especially for someone maybe looking at maybe trying to start their own venture, even if they are the term is bootstrapping, and again, I'm still discovering too. I went to school for nursing, but I believe on IRS they call it sole proprietor too. And to seeing what that can kind of look like, even whether it is for a woman who is single, whether it's a mother who's single, whether I'm trying to interject here too, or someone who knows somebody around that, that could kind of, I guess, kind of relate to that. And that happened more in your life that has really kind of influenced, and it could even be a story that's even out there. Again, it's still out there, even from when it had occurred for you.
Well, I think what's really, really important is to pause and reflect in terms of who are you and what do you want and what's an inventory on you right now. Because life just kind of drags us along. You get up in the morning and you head out. You know what you have to do, and you just go with a vengeance to get all those things done. And what I'm advocating is that you take the time to circle back and focus on yourself, because you are the number one asset, regardless of whether you're the CEO of a huge multi-million-dollar organization or you're just a stay-at-home mom trying to make it through the day and look after your family well. If you're single and you're trying to figure out what's next, always remember that you are worthy. You are the asset. You need to talk to yourself. And don't think that you need to go get help from other people. Just talk to yourself, because you've probably got the answers amongst yourself. When I got in the wealth advisory business, you head into a really terrific training program. You can't go anywhere until you've got all your licenses to put out your shingle. And then once you get started, they say, okay, Nancy, all systems are go. There's just one thing missing, and that is you don't have any clients. You've got to go find your own clients. And so part of the training was perfect, because they said, now, the people that you choose to work with, that you're prospecting, are ones to whom you feel you can add value to their future, because the relationship is going to be a long one. And you really need to lean into caring about those people so that you can bring your best forward to serve them exceptionally well. And so as I got started, I thought, okay, well, I'd already had a career at Procter & Gamble. I'd already had a career kind of involved with community leadership, running politically, not being successful, and then being recruited into wealth management. So I thought, I'm going to focus on women. And so one of the investment groups that I worked with, they had a whole marketing program focusing on women, and it was simply called Investing in Yourself. So that's probably where I got the first idea to circle back and focus on yourself. And then as I did this event, the marketing materials were all there. I just had to curate an event, which I did. Did it at a wonderful golf course, did it the first Saturday in November, which in Canada is kind of a sweet spot because it's after the summer, it's after kids back to school, it's even after Halloween, but before Christmas. And so, targeting women, and we know that women like to go to events in packs. They generally don't go by themselves. And so I had all these fabulous marketing materials, hosted this event. I had over 150 women who showed up. And so right off the bat in my career, I've got all these prospects with whom to follow. So as I did that, what I realized is we can't talk about a wealth plan because they're bogged down in all their responsibilities as a mom. And it's almost like every mom is expected to be the family's nurse practitioner. And so I'm thinking, how much do these women really know about health and wellness? I mean, I know a little bit, but I wouldn't presume to give people advice. And so that's when I got the big idea to partner with not-for-profit health-related organizations that were focusing on women. And in Toronto, we have this fabulous hospital that's over 100 years old, and it's called Women's College Hospital. Guess what they focus on? Exclusively women's health and wellness. So I partnered with them. They would have different seminars. I would invite my clients. They'd bring their friends. Or I would host an event, invite my clients. I started their first golf tournament because the 90s were not just the time when women were starting to pay attention to a whole wealth plan. That was also a time when they thought they better learn how to play golf. And so I hit the sweet spot, and the first one, I think we had 32 golfers, and 2 years later we had 144 golfers, so it was a big hit. So I went on from there. Heart disease is the leading cause of death for women, not cancer, not anything except heart and stroke. And so the symptoms for heart disease, quite different for women than they are for men. So again, let's get the Heart and Stroke Foundation to tell you everything that we think you need to know, increase your awareness, but more importantly, now you've got a resource to go back to. It isn't like you have to get on Google to look at this and that, or to try to get in touch with your doctor to get some information. Now you've got all these various organizations that are true professionals in their own right who have a wealth of information. So over the years, I did all sorts of those different kinds of events. But also, as I prepared wealth plans for my clients, I definitely built in the what ifs. If you have a critical illness, or you have a disability, or premature death, how is that going to impact your whole wealth plan? Because if you haven't addressed that and you're diagnosed with breast cancer, are you going to draw down your 401k or your retirement plan, or how are you going to pay for all the meds, all those sorts of things? And increasingly around the world, we just don't have the medical care that our parents probably had in the past. So none of us can afford to be sick. So that's why the first priority has always got to be your health, and then thinking about the what ifs and building in that protection into your whole total wealth plan.
Wow, that's truly moving. And to take a stand too, and I can only imagine where you've gone from where it is you started too. If it's gone internationally or whatnot. I mean, we're here now. I would declare this here and now international too, depending on whichever and who it is you're talking to. And to see that specialty, because I think that was one thing too that even for myself being in nursing school, seeing, I mean, and I only had one kind of class on it, but it's amazing too, even amongst even some of my peers or even women that I met in my day to day that I'd known in my life, how much education I had over them, and I wasn't trying to use that against it and anything, and not to say too, there's still this mindset I had too while I was in school that someone else had brought to light, and it became more than just one person, it became multiple, was who was making the real decisions around the health of a woman, and being able to see that, like, the proficiency and the discussion I guess the ability to have that discussion, first of all, Nancy, and second of all, to be able to talk around integrity and not personality or anything else that may be there, credentials, any other that. Because there is still, I think, what's working and what's not working in overall health. And I think there's still probably, I don't doubt it, and this is my next part for you, is what's really working and what's really not working when it comes into women's health, too, to allow them to not just see, I guess, to have that journey for wealth, to see that first they want to look at their health first, but what's really working and what's not working to even allow them to even start that.
Right. I think it's a whole new frontier that's beginning because people are really realizing that the research has not been done on women's health. And Melinda French Gates, for example, she's just donated $100 million for research. McKinsey did a huge study on women's global health and how the world would be different if we had known the differences between women and men pertaining to their health. So it's just a whole new frontier that's emerging. And as a result of that, women certainly are getting more information than they had in the past, which allows them to make more informed, sophisticated choices about their own health and well-being. I'll give you an example. We have another fabulous hospital in Toronto called Mount Sinai, and they've come up with a Sinai Women's Health Focus. And this past spring, they came out with a fabulous marketing program called Hot and Bothered. You know, all about menopause, put it front and center, like right out there. And so that's new. I mean, more and more it's becoming a topic of conversation, but really they just put it front and center. Well, of course, I'm well past that. And I thought, you know what? This is so true because it hits you in your 40s. And one of the turning points for me was turning 39. That's like when you're going into your 40s and you might just as well be 120 years old because it's like, oh my God, I can't believe I'm this old. Well, wouldn't I love to be 39 now? Anyway, what happens through that whole process is all these symptoms kick in, some of which women don't even understand or know. It's just they don't feel well and then once they do know, they never want to be embarrassed. So if you don't want to be embarrassed, then you just don't show up. You excuse yourself for valid reasons. And I thought, this is, I'm going to get involved. So I did get involved and did a bunch of events and really pushed it out because women need to just keep going. Like if you've lived long enough, it's going to happen to every single woman in this world. And it's like, so what? Now what? Just put yourself out there and keep going. And if you're having a hot flash or you're just, whatever, just acknowledge it and keep on going. The other thing that I realized is one of the symptoms is brain fog. And when you apply for life insurance, the last thing the insurance company wants to give you is the very best rate for your age and health status. More often than not, they'll bring something back that's of current concern. So this brain fog can be confused with early dementia. So you may be rated for early dementia when in fact it's simply menopause, which is just a normal symptom of menopause. It isn't early Alzheimer's. So all of these little intricacies are now coming out. More research is being done. And as a result of the research, more information is available publicly, which is perfect.
Wow. I want to acknowledge, you mentioned 39. I want to take a moment here to acknowledge, too, a nurse that I worked with. She was 35. She just passed away.
Oh, no.
Just a little bit after Thanksgiving break.
Oh, my.
From cervical cancer. So You're up to something, Nancy, and I want to be here and now for it, to continue to take a stand and commitment. And she's not the only nurse that had an impact on my life. I want to say that first for those who are listening in CNAs or whoever they may be, even down to environmental. But I want to take some real time, too, since, I have left the bedside, and I've been able to try to recreate in my own way, because it really is, it doesn't matter whether it's 39 or 35. I mean, who knows? 35 may be the new 39, at least for the next 10 years for right now. And that can all change, too. And I think it's not going to change from one person calling in to say something about it, too,
Mm-hmm.
So, but first of all, I want to acknowledge her. Her name's Kelsey. I want to acknowledge you, Kelsey. I'm not going to be able to make your wake, but you did have an impact on me, and a lot of, like I said, I want to make an outreach to other healthcare providers who have as well, whether considered professional or not at this time. And I just wanted to say that because it is interesting, because it makes us wonder too, and it's the question I think anybody can really have in a case when they have someone in their social structure, and it may be in an area of loss, is what could have been done? Was there something that was known, or was, like you said, was there some discussion that may have been in the way of, I'm not saying it's just about Kelsey, that there may be some like societal taboo of it being brought up. Meanwhile, you go back thousands of years and women were told to go to the river
Right.
for a certain period of time. So it's
Yeah.
like, full circle. So, and again, I'm still discovering that too. So, and it's interesting to see this discussion too at the societal level, as I think it still was being then at that time, and to see the integrity around that. Because I mean, some of the most meaningful people, I think, even over the last few weeks, I can say there's been individuals who are choosing, and I just have to say, I've seen it as a bystander, as a witness, and it's their own choice to go on the non-traditional route to be able to learn what it is they want to learn, whether it is considered non-traditional or whatnot at that time. Because even like you had said, there's this distinction too of a rate with life insurance with possibility around that too, and that it, and I don't know if this, because again I don't follow insurances and whatnot, is could you, and if you could speak on it, that'd be great at this time, is there's no discriminatory or lower of a rating
No.
for menopause, correct, that you
Right.
know of, correct?
None.
That still qualifies, it's still okay, but there's some discussion around this, and that's just one. I can only imagine there could be potentialities of a lot of this, and I could even say this too, and speaking on integrity, it'd be amazing to see full circle that maybe some people are experiencing other symptoms too that may not be of, and I'm not trying to say this or have the gender or identity discussion here,
Yeah.
not to say that I don't want to, but maybe other people are having these other atypical symptoms. I mean, I know back when I was in nursing school, one of the things I did too, working on campus, was I had a billboard on breast cancer, and I still had to put up the drummer of KISS. The drummer of KISS had breast cancer as a man. So it's out
Right.
there.
I know
So,
exactly.
So, and it, I don't know. I can't speak. I'm not a doctor. I'm a nurse. If those symptoms could be something, and to see even too, doctors are using drugs for off-label uses. I don't really talk about drugs a whole lot anymore, but I will speak on this because I think that's still a decision down the road. It can be the symptom. Hopefully, we look at the data, we collect the data, and get the knowledge, and then like the process goes, we go through, we add. Well, I was taught add pie, right? You assess, you delegate, you plan, you implement, and then you evaluate. And then
Right.
you can do that over and over again, right? And it may have been changed by now, but that's what I learned. And to be able to say that it's not just within nursing, it's cross industry, it's cross specialty, it's out there, Debbie, it's that big, and at the same time too, I still think there's the tip of the iceberg of what it is we're discovering around this, So, and I wouldn't doubt in future in time, again, I can't speak on it, I don't have a crystal ball, but it won't be the discussion of what if, it'll be, well, which option potentially is this that you want to kind of look at, and it may come down to, and it just had another potential, or just had another guest who recorded too, which is the eco-friendly route, or if that's the possibility there, or which one is that way and is economical and affordable and does this. That's kind of what I think consumers are kind of looking at, and I think it'll only have to be getting access to the correct amount of data and being able to kind of look at that if they want, and have it, how about this one, in a form they can understand.
Correct.
In a form, let's be professional, or whether it's unprofessional, or let's be skillful, I think, whether someone has a specific amount of degree, is still being able to relay that to another individual and have them get it, right? Not just
Right.
15 minutes of this is that what it is, this is what I have to say to you, this is my disclosure, I know I have all those other discussions and stories. Because I'd be curious how much more we could really learn from someone wanting to share even out of that, because
Sure.
I can only imagine being in a woman's health appointment and being able to see stuff maybe just flow out, and then another thing becomes another thing, and another thing, and that may be the pattern. And it could be for any patient. I've seen that happen with patients, so far that I've seen. So it's not just that, but I think being able to give it that light with the up-to-date ability of as to what it is we can really do in whichever
Right.
situation.
And
And then
we'll-
allowing choice. Yeah, I think that's the other one too.
Exactly. Well, one of the podcasts I was on, this woman commented, if you're having a colonoscopy and they give you the treatment to take beforehand, she said, are you telling me that for me at 120 pounds is getting the same potion as a man who's 220? Like, how does this make any sense? Should there not be different? And the
And
nurse-
meanwhile, they may have some taboo, and I'll speak of that because I think I've seen a patient similar where they may have accidents in the bed while they're a patient, and then whether or not they put the call light or not, whether the individual is in the room to help in that kind of situation, they wonder why they're falling so often, Nancy. They wonder
Yeah.
why they're falling so often.
Yeah.
And you're correct. They're 120 or under, and they're following sometimes the same kind of a regimen.
Right.
And I can't speak as to whether or not I have seen that, but I can definitely say that there have been people who have frequently had episodes and have fallen. So
Yeah.
and it can only be a number of different variables to look
No.
at. And that's with inpatient, right? Let's imagine outpatient, the day-to-day, being able to go and do activities of daily living, and then, as you spoke to earlier, too, is to have longevity with that.
Correct.
And then to be able to go out and go beyond self, right? And to be able to
Exactly.
have the health and the wealth to be able to spread on that, too. And it's amazing. They don't really teach it that way in school either, too, because it's amazing too that people that, and you've spoken of it, they are at this ability, and I'm still discovering myself. I think it's lifelong. What I've discovered so far is money no longer becomes an issue, but then it becomes this hyper emphasis on health, and it's like, well, which is it? And is life more of a marathon for you? You know, and what it is that you're kind of wanting to look at with that, and preventative wise, I think being able to have access to preventative measures and see how affordable maybe those may be over, say, the long
Right.
term.
Right,
Or
exactly.
chronic management of it too. So, and I think consumers are looking more at that too. I can speak of the task force prevention. I learned about that when I was in nursing school, and I think that's still around. And that's why specific tests, can and cannot be affordable for those who don't know.
No.
Please check it out. Especially if you have insurance. And here's the other one is to who does, or if they can afford it, like you had mentioned earlier too. And yet the body's still keeping count. Things can still happen.
Correct.
And then life is still there. So, I guess, what is the future? I guess I'm not really trying to say crystal ball, but like, where do you kind of see women's health kind of going? Or how about this? We could speak of where could some disruption, if we had to, not violently, right? That we could really kind of hone in today's world using, say, the resources that we have.
Well, I think AI definitely will have a big effect. But then at the same time, we can't turn our entire existence over to AI. Like, we've always got to be knowledgeable and discerning to the extent that we can. Otherwise, you do the same way, what do you call it, when you dial up your bank account or you put your finger on and away you go. Well, that probably same thing will apply to our health. But can you trust everything that's going to be recommended once that surfaces? Once you get some feedback, are you going to trust everything that it's telling you? So you still have to be really, really, really discerning and try to educate yourself to the very, very best possible way that you can. I've encouraged people to get involved with their local hospital. Just about everybody knows where their local hospital is, because if you call 911, you know where you're going. Well, go there on a preventative basis and see what sorts of seminars or presentations they're offering. And if they're not offering them, why don't you ask them if you could work with them and organize an event? Because the closer you get to those professionals who know a whole lot more than you do, the more educated you become, and the more awareness you are of different possibilities and approaches that you can take to remain healthy. And once you get it, as women, we're more than happy to share with as many people as we possibly can. So there's definitely a ripple effect in a very, very, very positive way.
Wow. Well, I guess the other thing I'm kind of thinking, and I'm thinking here, is an angle, is within current decisions, and I just wanted to bring this one up, is who's the one that's really making decisions or bringing up legislation around these? And I just didn't know if you wanted to speak to those, even through history, from what you know. I mean, and where it is you've seen it, where it's kind of at, and the integrity around that, as to whether that works or doesn't work, or maybe there isn't anything. What's there for you?
I think a very small percentage are making the decisions about what we should have and what we should do, because we basically give up that right. We're not involved. We're not paying any attention. We're just running our lives and taking our health for granted. And really, we don't pay any attention until something comes out that we don't like. And then, of course, it gets our attention. And then it's an outrage. Well, guess how long it takes to make a change back to where you think it should be. So to the extent that you can, try to get ahead of that whole wave by educating yourself so that, as I said, you can be very discerning, whether you should or you shouldn't. Your body, your health is your decision. And this is what I've encouraged people all the way along, is you're worthy of owning yourself. So don't pass it over to other experts and think that they've got your best interests in mind. They may very well have, but you need to understand why they're recommending what they're recommending and possible side effects or whatever. But don't just turn your existence over to a wealth advisor or a health advisor and accept what they're recommending without some questions. One of the best ways to find out how healthy you are is to apply for life insurance, because they'll tell you in a nanosecond what they have concerns about. You don't have to buy the life insurance. I mean, I am an advocate for life insurance, but at the end of the day, whatever's offered to you, you can decline. But in the meantime, you've found out how healthy you are.
Yeah. And that's a possibility that's out there. I mean, to acknowledge, and thank you for sharing that little tidbit for those who want to kind of at least even have maybe even a starting point.
Right.
Because, I mean, and it's not the first time medical professionals have really kind of looked at the community aspect or affordability aspect. I remember
Right.
one thing, even whether I just made it through the class or not, I took critical care, and I learned about what's called the SOFA criteria. And I don't know if you're familiar with it, but for those who aren't, they had a bunch of doctors from all throughout the world got together, and they found out that sepsis was an issue. Infection in the bloodstream, and they're like, well, what do we do? Well, they said, well, we don't have resources in this parts of the world that you guys do, so they had to kind of come up with a solution, Nancy, and one of their solutions was this SOFA criterion, and pretty much what it is it's the minimal equipment and still being able to get the answer that it is that they need, even with it, and it could be even from just, I think one of them was you get the blood pressure using a manual blood pressure cuff. Those who know it as the squeezy one from
Yep.
growing up and whatever else, but yeah. And to see that, if that's the mindset that's been going on around something that was worldwide, I mean, women are another predominant that's out there, and to be able to see too, and this is, I guess, be more of the disruption part. Some people, even in the States here, are wondering why it is that grown men are making decisions about women's bodies.
There you
and
go.
See that as an area for discussion. So,
Exactly.
yeah, yeah, and no, what's there for you? Yeah.
There's a fellow in Canada who's doing a great job, and he's written a book called It's Never Too Late to Be Healthy. So if you've kind of mopped along and you're still alive and you still feel okay, but you've got some concerns because you're living that much longer, and going into your future it may not be as easy as it has been up until now. And so he just recommends a whole assessment of where you're at now currently, and thinking about changing your behavior in certain ways that you believe are going to enhance your health. I'm the first person to advocate that you work with a trusted advisor for your health and your wealth, but easier said than done, really. And but to the extent that you can, try to find a source that you trust that can give you information that you feel enhances your own well-being.
Wow. Well, we're at the point here where we have an empowering quote or a favorite quote that you'd like to share with our audience, and then we will go ahead and we will close. Thank you for this
You're welcome.
possibility and the sharing, and we'd love to have you back as a guest if you would.
Anytime.
And, yeah.
Well, Warren Buffett has a son, Peter Buffett, and I was on the board of a private girls' school in Toronto, and I heard Peter present in New York. A friend was hosting him. So I went to hear what he had to say. And of course, Warren at one point had given each of his children $1 billion. Since then, he's topped it up to $2 billion. And he expected them to be philanthropists with that money. And so Peter said, what do I know about philanthropy? I know nothing. And he decided that he would take a similar approach to that challenge as his dad did with investing, which is look for undervalued assets. And he decided that young women in third world countries were where he wanted to invest some money, because if you invest in their well-being, they will probably have fewer children. If they have fewer children, they'll probably be able to take a bigger role in their community. So again, it really has a big effect when you think about making a change to that one person's life. But he wrote a book, and this is my quote, which is, life is what you make it. So you live your life and you love your life. Like really, your life is a gift. And it is a privilege. We know that there's so many things that are wrong in this world, and so many lives that are just treated so inhumanely. So if you've got the privilege of having a positive life that is pretty healthy at this point in time with some wealth, you are blessed. So live your life and love your life. And then, of course, the third part is to give back however you can.
And for our audience, thank you for that. If they would like to get in contact with you or reach you or get more information, what is the best method for you?
Send me an email, and then you go into our database. We're on all the social media. And when we come up with new ideas, obviously our database will know, but then also we push it out on social media. But my email is nancy@womenworthwellness.com. nancy@womenworthwellness.com. That's also our website, so you can go there, see what we've been up to. And by all means, send us some suggestions in terms of what other things you think we should be covering. We're happy to. I have a terrific assistant, and I had another person do my website because she's great on social media. So she's talking to the website guy. Her name is Crystal. His name is Andrew. Crystal says to Andrew, Nancy knows absolutely everyone, and if she doesn't know them, she introduces herself to them. And that's so true. So tell us what you think we should do. And if it's somebody I don't know, I'll introduce myself to them, and away we go. We'll make it happen.
Phenomenal. Thank you for this joyful ride. As the other part is, we talked about health, we've talked about disruption, and now we've also talked about the joy. So
Okay.
thank you for that.
Well, then I have to show you my shirt.
Well, there you go. Even more.
Okay, Brett, thank you so much.
I hope our viewers, and yes, well, no, we'll drop this. It'll be on Thursday this week. So, and if they're listening, they'll be like, "It's Thursday," and you said it's Thursday. Yes, I know, we did do that. So, thank you very much for the possibility, and hope you have a great rest of your day. Thank you, Nancy.
Thank you.